the old COVID, and I think also this is what people are getting a little confused about, because COVID-19, which is called COVID-19, CO, Corona, VI, virus, disease, COVID, COVID-19, because we learned about it in 2019. That does not exist anymore. People just get that out of their minds. That is long since gone. To be replaced by alpha and beta and iota and gamma and lambda. Lambda isn't actually we gotta worry about, but delta is the one that we have to really worry about now.
Dystopia tonight. Dystopia tonight.
Yeah, no, we wanted to bring you on just because everything that's been going on with COVID and stuff. And I met you over the pandemic because of Tom, because you guys have an awesome show called Facts Not Fear, right?
Yes. Yeah, exactly.
Got it right.
Exactly.
Okay,
which,
good.
unfortunately, or fortunately, because I think the world of Tom, I think our show might be making a resurgence.
Making a big comeback.
Yeah. So,
resurgence is such a loaded word.
I know.
Yeah. I know it is a shame that you guys have to come back but it's nice to have you back.
Yeah.
It's gonna be nice to be back, I think. I think the whole idea of the show was to make it so that people don't look at this as a fearful thing, but it's just something that they need to be educated on and be as safe as possible with. And Heather has all this knowledge. I'm just good at helping convey it over to the normies.
Don't be fooled. Tom is like in the elite of public health experts now, particularly on COVID. So he knows what he's talking about.
I felt like a hybrid of John Paul Veromo and you, last night, maybe it was, somebody tweeted something, right? And I never get into these tweet discussions like John does.
Right.
And I found myself getting swept up in one because somebody had made a comment about and this is a perfect segue because this is what John wanted to talk about Joe Rogan's comments, right?
Yes.
So my retort was, I guess if you get enough followers, you become an expert in any on any topic. So somebody had like a nasty comment back at me, right?
Yeah.
I was like, who is this Dr. Orange Bitcoin or whatever the person was? And they were like, or you just follow things that you think are true and blah, blah, blah. So I was like, no, I agree with you. I'd prefer to, and this is where I call it the hybrid of Heather. I was like, I prefer to read peer-reviewed, unbiased articles to get my information. How about you? Right. And then they just kind of cursed me out and said, just don't try to tell me what to do. And wrote me up. I'm like, I'm done with Twitter.
Which, by the way, is so funny because I love the "don't try to tell me what to do" thing. You know what? I wouldn't give a fuck what anybody did. I love that it's become a freedom issue because I feel the same way about this that I did about smoking. You know what I mean? What if smoking only fucking killed you? Have at it. Light up 20 packs. I don't give a fuck. But the fact that it interferes with everybody else's lives, kills other people. I don't want to shorten my lifespan because you're a fucking moron. I will acknowledge that there are stupid people, but just go live your stupid fucking lives and don't affect me. But COVID, unfortunately, affects us all.
Yeah, I mean, it's an exquisite argument, and I sometimes think that people kind of don't understand the public part of public health because the public part of it means there is a public, and they are impacted by what you're doing and what's going on. And, you know, it's interesting because in public health, I say this a lot. I'm looking at my textbook over there, but, you know, my textbook 2 years ago, the bulk of the textbook for my law school class focused on things like obesity and diabetes and a little bit of smoking, soda ban. That was a big debate, right? The soda ban, and should people not be able to buy, you know, now it seems so quaint, right? It's like the soda ban was like the hot public topic of our time. But you know, 4 or 5 years ago, the public health issues we were dealing with, public health had sort of kind of slidden a little bit away from itself because we were really dealing with things that, to your point, weren't really hurting anybody in the short term, right? I mean, like if you wanted to get that extra, like, big gulp soda, okay, not great for you, but I can watch you do it and say that's a bad move, and I keep it moving. But that's a very different thing than somebody smoking next to you, or obviously somebody who actively has COVID and decides to like go out in the world and living their best lives, and then you have to suffer for it. So I think the continuum of what we mean by public health shifted over the last 100 years when we didn't have a 1918 pandemic, and now the pendulum has swung back but I think what we're seeing is people who've been living in this 100-year bubble of soda bans, and they're like, I should be able to drink my soda if I want to. That's public health. Okay, but
the only
a little different than COVID. So I think that's what people are reacting to, is that civil liberties public health argument they've been hearing for 100 years, but we've been using it for soda and French fries or freedom fries, whatever we're calling them.
Yeah, exactly. It's weird to conflate the two issues. So I feel like as a public health expert, that has to frustrate the shit out of you, is that people aren't having honest arguments about it. Because how are you able to talk to people about what they need to be doing when they're arguing the wrong thing?
It's very challenging. And so then this is actually, we talked a bunch about the research that I'm doing. One of the research topics that I'm looking at is people's personalities and how that impacts on their desire to engage in certain behavior or not. Certain personality types are just, you could tell them a million times they should wear a mask, and they're just not going to. And other people, and we both know all these people, right? Other people, you can say you need to wear a mask, and they're like, okay.
Yeah.
Right? They're not going to ask anything. They're not going to question it. They're just going to put their mask on and walk down the street. So, in terms of, it's not so much that it frustrates me, although it can be a little disconcerting now that we've been in this for like 18 months. But it's more, in my mind, you have to figure out the right messaging for your audience. And unfortunately, or not really unfortunately, just how people are, there's lots of different messaging that you have to get out there to appeal to different people. So I don't know if I was telling you the story, but in class a couple of months ago, I showed this video. It's a PSA that Jill Biden did with her dogs about COVID. And I showed it in class, and I said to my students, what do you think about this? And the first hand was the student who's just like, that's a ludicrous PSA. Like, who is going to care what happens to your dog with COVID? Like, anything about dogs? Like, where is the data? Where is the science?
Right.
Like, that's not there. Yeah. The next hand that goes up, I actually totally disagree. I like dogs, and I care what happens to them. And if I see that, if you're dead, nobody's going to be able to take care of your dog, that actually has an impact on me. It resonates with me. And so the class was kind of split, with half the class being like data, and the other half of the class being like, oh, budgie. Right? So that's a really good example of a PSA that, at the same time that it can speak to some people, repels other people. So that's more how I see it. You got to figure out, okay, you might have to have 7 or 8 public service announcements that appeal to a wide range of people before you hit 72% of the population.
But do you think there's a problem with how many of those there are? Because, the problem is that I wish that, like, the dog people would see the dog PSA and the kid people would see the kid PSA, like, and that kind of stuff. Because I feel like the problem is that we see a lot of them, and they see it as a tactical maneuver to get people subjugated, instead of, hey, look, the society is fractured, and we're trying every way we can to appeal to different parts of the country. But instead they see it as a threat. I mean, that's like, it's frustrating, because that's why there's the people like, I don't give a fuck about dogs. And it's like, now we got to figure out what this asshole cares about. And then, but the problem is at what point do you go, all right, I don't give a fuck about their individuality and what they care about anymore, and now we're going to do what we need to be done to survive. Like, I feel like that's what vax passports have kind of become.
Right. So, now we're at a place where, do you do you basically make people do? I mean, I think, you know, public health at its most basic is an argument, a civil liberties argument. So it's you know, do you you know,
He makes a
the
good point.
question is, do people have the ability to exercise their civil liberties unfettered, or does the government have the right to come in and truncate them somewhat? Then the Supreme Court decided this. Tom and I talk about this case all the time on our cast. It's called Jacobs v. Massachusetts. It's a 1905 case. It dealt with a man named Jacobson, shockingly, who didn't want to get the smallpox vaccine. And the question was whether or not the government had the right to either fine him or incarcerate him for not getting the smallpox vaccine. And the answer was yes. Yes, they did.
Yeah.
They did. Now, that case didn't go so far as to say, and the government had the right to mandate that he get the smallpox vaccination. But implied in that case was that the government potentially
could fine you.
have such a right. Exactly. So, yeah. So now we're in an uncomfortable place because, you know, certain people just didn't want to do certain things that now the population as a whole is getting to a point where they're going to be mandated to do these things if they want to go to work.
Yeah.
Which, you know, go to dinner.
Which, by the way, I feel like at this point in time is perfectly fucking reasonable. It's been over a year, almost close to 2 years. We've given them every opportunity to abide by the rules, abide by the mask mandate, try to stay locked down. We never had a real lockdown. We never had a full lockdown because there were morons still fucking opening their businesses and then, you know, protesting outside of gyms and stuff, and, you know, traveling and all that other shit, you know, screaming outside of a Fuddruckers that's been closed for 6 years anyway, you know, all that other shit. They've been doing that incessantly. So we never had a real lockdown. And then, you know, and then on top of it all of us went and signed up for the vaccine. And, you know, and then in spite of people doing the right thing at the end of the day, you know, we offered them free beer, fucking trips to Disney, a hand job, you know, like whatever. And it's like, enough. They've had plenty of offers. Nobody got offered the hand job. You all don't know the dude on. You guys don't know the dude on.
Only your doctor.
Yeah. You guys don't go to the doctor in the alleyway on 13th Avenue, Broadway. But yeah, it's, you know, it's insane. And I feel like now, you know, I'm the least government overreach person imaginable, but I feel like, you know, it's not about the government. Like, the government does have to step in now, but it has to step in on behalf of the educated and on behalf of scientists. You know,
and as a rogue primary care practitioner. Mike's also a friend of the channel, but he was a military guy, and he said, "Boo-hoo!" He's like, "The military's been making me get shots for decades."
Well,
Nobody ever said.
He makes a fabulous point. I mean, you know, there's certain sectors where you just really don't get a choice in much of anything. The military is an excellent example of that, where you're serving your country and you do what you're told, and that's primarily so you can safeguard other people. I mean, you can't have people sort of running around talking about, I'm not going to do this and I'm going to live my best life. In the military, we'll all be dead. So,
right.
You know, the certain sectors where there's even less ability to talk about your civil liberties. You don't really have very many.
Yeah,
so exactly. 6 experimental anthrax shots.
Exactly. And the funny thing is that these people that are protesting it and talking about freedom and all that other shit are fucking cowards. They're ballless wonder, because the military has had to have to go through that, and they're the ones who see themselves as they do anything for the country. They're patriots. They're going to fight for the country, and they won't do the simplest fucking thing they can do. They wouldn't sit on their asses over the pandemic and collect unemployment, or just do whatever they could do, like the rest of us did, to find a different way to make money. And, you know, and they also won't get the vaccine. It's insane. I mean, you have to have at least 5. Am I right? Is it still 5 or whatever to fucking go to kindergarten? Right? Like, you need to show we've always had to show papers.
Oh, the vaccinations.
Yeah.
Yeah. I mean, I see, you know what, I as a public health person, I think the thing that I find completely amazing about this whole scenario. And again, if you'd asked 10 Americans 3 years ago, what is public health? 9 would have probably said, I don't know. And the 10th one would have been like, is it a TV show? So, I think most people had yeah. So most people didn't really had neither an idea nor a desire to know about public health and what it means in their lives. But public health is everything. I mean, that's a great thing about being in public health, because you kind of like point to anything and be like, oh, it works very well for me. But exactly this notion that we haven't already had our civil liberties infringed through any manner of public health initiatives, and people don't get tons and tons of vaccines all the time. I mean, the anti-vaxxers have been screaming about vaccines for forever, and it's very interesting to me that people just slough them off as crackpots and idiots. But in terms of the arguments they were making, which I don't agree with a lot of them, but they were making some interesting arguments that now all of a sudden everybody's an expert on, right? And now everybody is like the next civil liberties lawyer, and everybody wants to talk about their rights and what vaccines they shouldn't be getting. But we've been getting them all for forever and ever, and people were just going off to Mets games and Yankees games. I don't know why they're going to Mets games, but Mets games, and Yankees games, and hockey games, or wherever they were going, not really thinking about it. And now all of a sudden, liberties are being infringed. But this is not people's first time at the rodeo, even though it's the first time for a lot of people that they're paying attention.
Yeah, exactly. And it's weird. The only thing I don't like, I don't mind people choosing their own way to die. I just don't like when it's chosen for me. And I feel like we're just always heading in this direction. Like, I mean, I keep listening to scientists or whatever, people who are like, we've got climate, everything's on fire. New Jersey has fucking tornadoes now every day. You know what I mean? Or whatever. It's insane that we never had them before. And then on top of it, though, I think more than anything else, the resentment I have is toward being dragged out by the dredges of society. Basically into another COVID spot. They don't even think that, like, somebody had said to me, can you please debunk this in the only way you can, which is always amazing, is that some idiot was saying the vaccines are causing the variants. I don't even know how to begin to unpack the variants. Vaccines. Have you heard that one yet?
Yeah,
I try. I couldn't. I couldn't explain it in a science, but I was like, you do understand how viruses work, right? Like,
they don't. Apparently, they don't understand that.
Yeah, exactly. I'll leave it up to, because I can't. I fucking can't.
Okay, so it's actually pretty straightforward. So, virus, you get infected with the virus, right? And when you get infected with the virus, I call it a carbon copy, but then I realize a lot of people of a certain age probably don't know what that is. Like, I never actually seen like a carbon copy, but
right.
For old-timey people, it's not just the CC on emails. There used to be this black sheet of paper that was called a carbon copy because it was the way that old-timey people made Xerox copies. Like, before you had a Xerox machine, you would like put the little black piece of paper in between two pieces of paper, and it would create something that looked like the version you had been writing on the original, but it was not exact. There were like little glitches with it and so forth. That's how you should think of a virus when it goes from one person to the other. So when a virus goes from me to you, it doesn't exactly replicate the same. So there's little differences and little mutations, but the vast majority of the time it doesn't matter, because it's things that don't make the virus any worse. It doesn't even really do anything. It's just, it does what it does. That just happens just when it goes from one person to another. But every once in a while, when you get the virus that replicates from person A to person B, it creates a mutation that's significant enough that it actually changes the very nature of the virus itself. Now, that we can call that a different strain, or we can call it a variant. They're kind of interchangeable. Strain is usually something vastly different than the original. Variant, it's still within the same family of the virus, but strain, variant, they're somewhat interchangeable. But let's say variant. So now you have this variant. And then the variant, if it is able to be robust enough, it winnows out all the other previous viruses that were the one that came before it, and it becomes the dominant variant. So that's what. So the old COVID, and I think also this is what people are getting a little confused about, because COVID-19, which is called COVID-19, CO, Corona, VI, virus, disease, COVID, COVID-19, because we learned about it in 2019. That does not exist anymore. People just get that out of their minds. That is long since gone. To be replaced by alpha and beta and iota and gamma and lambda. Lambda isn't actually what I'm worried about, but delta is the one that we have to really worry about now, right? So delta and all the variants before it were stronger and more robust, and from an evolutionary standpoint, better than its predecessors. So it took care of the others, and now it's the new game in town. And that's how you get variants, which, viruses mutate, as I said all the time. A variant is going to be something that's going to be a step above your normal garden variety mutations.
Yeah.
And by the way, all variants have multiple mutations. So the alpha variant that came out of the UK had over a dozen mutations. The ones we cared about were 2 or 3 of the mutations that made the spike protein able to penetrate cells better, and it made it. I always do this. Tom's seen me do it before. It made it stickier.
Okay.
It stuck better to cells, so it made it stickier. But that was alpha. But even the alpha variant is no match for the delta variant.
Wow. And so another thing I was going to say too before because I would like to talk about the other variant as well, but these variants would not have been. I don't think there wouldn't been as many if people had just locked it. Like, we could have stopped the variants.
Okay, so you bring up another good point. So the thing about variants, another thing we should know, that this is where it gets, to me, particularly scary. I shouldn't say scary. That's a harsh word to use. Concerning. Where this gets concerning for me is we see variants in people who are usually you see them in people who are unvaccinated or people who are immunocompromised.
Okay.
And there's been interesting case studies of people who have very weak immune systems, and they can throw like dozens of variants within their own body. So these people who have COVID for like 100 days, 150 days, they can't shake it, they just have COVID. These are the people who are getting multiple variants at the same. So they might have COVID, and then a variant, and they still have COVID, and then another variant pops up, and another variant. It's the people who either are immunocompromised and they have COVID for like 100 days, and they're just popping off variants, and those variants are making their way into society, or people who are unvaccinated who are, remember, again, when you get COVID and you give it to somebody else, there's a little bit of mutation, but the people who are giving it to other people who are getting COVID, especially the unvaccinated who are getting way worse COVID, these are the people, that's how variants are created. And not from the vaccine.
Thank you.
It's from the people who now have gotten COVID, and they, because of the little mutations, they have a couple mutations that are really, really challenging. That turns into a variant, and those people who now have COVID create within their own body. So a variant always just starts with one person. It starts with one, and you get a variant from one human being, and then it goes to other people. So a variant always starts with one person. It starts with people who are not safeguarded against the virus, and it replicates to other people because it is has an evolutionary advantage.
Thank you. See, that was beautiful. So now let me ask you this then, because I'm just going to keep asking you questions that clear things up for me, because these are conversations I've been having with people. I had a friend who got COVID. right? And this is before the vaccines were doled out. She was doing basically where they were doing like, well, I'm following the CDC guideline. I'm wearing that. But the problem is they were still, they were still just in groups, or they were putting themselves in positions where they were around people they didn't know. She wound up getting it. She wound up giving it to her whole family. They've all got it. She got her first vaccine. She has a thing where, she winds up passing out. She gets stressed out. She's always had that her whole life. She has like a seizure. She passed out. So she was afraid to get the second one. She's lost the timeline, right? Like basically it's been without, 48 days or something like that? We're
42 for Moderna.
42 for Moderna. It was,
but you have to get Moderna within 28 days. You have to get Pfizer within 21 days, and then you're fully vaccinated within 42 days for Moderna.
She only got the first vaccine. She never got the second, and it's been well over
out of window.
Let me ask you this now, because this is what I kind of heard mixed things on it, and I don't know what the real thing is. If you've had COVID already, the whatever version of it that they had, they got really bad cases, the whole family, but they wound up making it out of it. I think it was very much towards the end of it, like right before you could get the vaccine, right? I think they were just doling it out.
Yeah.
So they got it. If they wind up getting the Delta as well, is that a bad cocktail, basically? Like, because I think they believe that they have an immunity towards this new, not a complete immunity, but like they're going to be okay because they've already dealt with it. That's a misconception, right?
That's a misconception on a number of levels. So one, it's a misconception because depending on when you had, so let's say you're one of the, I call them the early adopters of COVID. The early adopters in like March 2020. I knew you'd like that.
That's fantastic.
You're an early adopter of COVID in like March 2020, right? Well, we're in August of 2021 right now. So the notion that you still got a super robust immune system 18 months later,
right?
Maybe you do, but I sure want to hang my hat on that. So that's the first thing. We're talking about if you had COVID in March 2020, you had COVID-19. Mm-hmm. You had the novel. Remember the novel coronavirus?
Yeah.
Not novel anymore. Okay, so you had the novel coronavirus. That's what you had. But it's like having a cold versus coming up against like, Godzilla cold. Like it's not going to work out well for you. All right. So now, but even if you were still dealing with the novel coronavirus, COVID-19, 18 months is a very long time. So, are you going to have antibodies at the same level that you did in March 2020? Of course you're not. No. Mm-hmm. Now, so there's T cells, there's B cells. The body remembers diseases, right?
Yeah.
That's the beauty of the body. It does remember. It remembers. So if you were presented with the Delta variant 18 months after you had the novel coronavirus, would your body remember that? It probably will recognize something similar.
Again, your body's like, I remember this and this fucking sucked. I'm giving up. I'm shutting down.
I want no more part of this.
Yeah, I can't believe you do this to me again. We're getting the fuck out of here.
There you go. Exactly. So your body might help you out, and it might sort of like get an immune system response going. Mm-hmm. Might be okay. You might not be okay. Again, people's immune systems are different. All immune systems are not created equally.
Right.
So some people, these people are like, I never get sick. That's great for them. Other people are not so lucky. So a lot of it has to do with how good is your immune system? Are you sick? Do you have underlying diseases? So mm-hmm. forth. But then to your point, we're now in the realm of the Delta variant. So would I trust my COVID-19 March 2020 disease up against the Delta variant? I wouldn't. I wouldn't be comfortable hanging my hat on the fact that I had COVID 18 months ago or even a year ago, and I'm going to have the same robust immune response that I had a year ago, and it's going to be a response to the Delta variant. So for all those reasons, I wouldn't sort of be patting myself on the back if I had COVID saying, oh, I'll be fine. And I think we've all heard of people who have had COVID more than once. Mm-hmm. So for all those reasons, I would, if I had COVID, I would not, that would give me small comfort up against the Delta variant.
Yeah. What is the discussion like? I mean, among people who are basically like, because it's getting close to the wire when it comes to getting as many people as we possibly can vaccinated, and then the idiots who don't want to get vaccinated, and then the people in the middle who, you know, have some concern. You know what I mean? Is there just like, our public health officials and basically the scientists who are pushing for this kind of like, you know, fuck it, we're just going to implement whatever we can and put restrictions in place, and then until we, like, is their main goal like, just get this fucking virus to go away and we'll deal with these lunatics afterward?
Kind of, but now we've got a new problem, and that
Lambda
is that, well, yes, well, Lambda, we have to talk about that too. So we've got a problem with Lambda, but even with the current Delta variant, even with COVID, you know, the vaccines don't necessarily stop you from getting COVID. Okay, so people who have been vaccinated are perfectly able to get COVID-19, and many people who are vaccinated have gotten COVID-19. The reason why the numbers aren't higher and we don't know is because a lot of people who have gotten vaccinated are not getting, you know, tested anymore. They're like, I got the vaccine, I'm fine. I'm not gonna worry about it anymore. And in my mind, can't get anymore. But that's another reason why I'm always intrigued when, you know, somebody who's vaccinated is around other people who haven't been vaccinated. Both because if you have been vaccinated and you have COVID, you know, you could give your 5-year-old child COVID. You certainly could if you were infected with the virus and you were around somebody who can't get vaccinated, because if you're under 12 in this country, you can't get vaccinated. So a child who's 9 years old, who's 8 years old, who's 5 years old, who's around people, vaccinated or not, they are unfortunately vectors for the disease. They're primed for it. So, by the way, if you care about nobody else, what you should care about is that you being vaccinated could be carrying the disease, and people under 12 can't protect themselves. They have no protection against COVID at this point. So even if you don't care about other adults, what you should care about are like babies. Babies can't get vaccinated. A newborn can't get vaccinated.
There was a newborn that was born with COVID.
There you go.
Yeah,
there you go.
First one.
There you go. There you go. Okay, so so for all those reasons, the notion that, you know, people are somehow do you remember, I don't know if you ever saw the Wonder Woman, like the Linda Carter Wonder Woman, where she had the invisible jet and she was riding around, and so it was like Wonder Woman and the invisible jet, but you could still see Wonder Woman. Exactly. I say that I feel like people act like they're Wonder Woman. You know, they're Wonder Woman in the invisible jet, and COVID is just going to bounce off their invisible jet, and they're just going through like, but that's not how any of this works. You're not Wonder Woman in an invisible jet. You're just your normal self living your life. You can get COVID, you can give it to other people, and you can certainly give it to people who can't get the vaccine. And those are again, people who for whatever reason are not able to, and people under the age of 12. So if nothing else, you should be worrying about them.
Yeah, I completely agree. And it's that's what I was saying before when we were talking about the dog thing, is like, you would think at some point, because that's another thing people are trying to go down, which is like, hey, look, kids can fucking get this shit now. But the problem is we live in a country where an active shooter can march into a kindergarten class and murder how many fucking kids, young children, kindergartners, and the country's still like, don't know about the gun law thing. We kind of like our gun. So like, it's a hard sell even with a COVID thing, unfortunately. It's the same fucking people though. It's the same people who don't care about the gun issue, don't care about COVID or any of that kind of shit, because they all think the craziest thing to me is the videos that I constantly see of people who bucked the fucking vaccine, didn't want to get it, either straight up fucking dying from it, or the people who have done that and have thankfully though documented their COVID until the very end, until they passed away. And a lot of people have been doing that, and that still doesn't seem to. That's why I don't mind, again, the government stepping in this instance, because it's like, it's like, what the fuck are you supposed to do in that case? You know what I mean? Like, what is anybody supposed to do now if they've got people who are like actively like, look, I didn't want to get the vaccine either. I miss my, I'm never going to get to see my wife again. I'm dying of this thing. And you can watch there's a few people who've done it, who've videotaped themselves or taken photos, and you see the whole, and it's sad as shit. And they still don't do what needs to be done. And now the Lambda variant that's out there, is that the one that they say that they're not, because the Delta one, my friends got who were vaccinated, they both had Pfizer. They were with coworkers who had not gotten the vaccine. Mm-hmm. And not because they didn't believe in it. They were literally just too fucking lazy to get it. Like they didn't get around to it yet. And they meant to do it. They just didn't do it. And of course, so they were out or whatever. And I think the husband or something like that got it. And then their friends who were vaccinated, my friends who were vaccinated wound up getting it. And the juxtaposition between the two, the unvaccinated who had to deal with the Delta variant, was like night and fucking day. I mean, like my friend, even though like, they had to go, my friend didn't have to go into the hospital who was vaccinated. But she was having cognitive issues. She was like, I literally cannot and she's super smart and like, she's got a great job and, and everything like that. But she's like, I can't finish a sentence sometimes. Or I don't know what I'm, about to say or whatever. And she's fine. Like she's gotten over it. But the fact of the matter is that she's like, I don't know how long or what permanent damage it did. I hope it never comes back again. It's a fucking scary thing. But is the Lambda variant, we don't know if it's going to put people with vaccine.
No. Okay. So he said, based on what I said, people have no reason to get vaccinated. No. People have a very good reason to get vaccinated. It's the thing that John just said, which is, do you want to have a horrific outcome that involves death?
Right.
Or, see, here's the problem. People who are vaccinated, most of them don't know they have COVID.
Right.
The good thing about that is the vaccines are working so well, people are just plugging along and they don't know. The bad part about that is they are vectors for passing the disease on to other people. And the people who should be most worried about that are young people under the age of 12 and people who are not vaccinated.
Yeah.
So when you've gotten the vaccine, the likelihood of you having some horrific outcome from COVID is actually pretty low. Now, are there some of these, and the example I always give are the Yankees, who keep getting these outbreaks of COVID.
Yes.
With their team being fully vaccinated.
Yeah.
Oh,
yeah.
Okay.
Oh yeah. But that is kind of funny because I was thinking the same thing as you explained. But it's like, how many times can you say like it's the funny thing is that between the vaccine and not getting it, it's still the same as it's been in the beginning, which is death or not death. Your options are wear a mask, socially distance, or wind up in the hospital and potentially die. And then the same thing with the vaccine. It's lessened. Like my friend, when she didn't know she had it until she got tested because she was just waking up. I mean, she has allergies like I do. She was waking up constantly congested, maybe a little pressure, like a headache kind of a thing. But if if those are the symptoms for the Delta variant, and it's not, because Delta apparently is not loss of taste and smell anymore. Apparently,
no, it's
different. Yeah, it's and then it's like, so, and then the Lambda variant is like the other thing that I feel like that's not the Colombian variant that's out now, though, right?
No, the Lambda variant originated in Peru. And that's the one I personally think
is gonna. You're hilarious. That was hilarious because your tone changed from, and you were like, "That's the one." I was like, "That's about to kill us all." That's you. You didn't say it, but like that's your tone change.
Yeah, So it does appear possibly maybe that it has the ability to evade the vaccines.
Mm-hmm.
It also appears to be more penetrant, so it's able to let me backtrack a second. One of the big issues with the Delta variant, which is why it's able to manifest itself in people who are vaccinated, is because the Delta variant has a huge viral load. So when you get infected with the Delta variant, there's a lot of virus floating around in you, and there's a ton of virus floating around in your nasal passages.
Right.
So that's why when you have the Delta variant and you have been vaccinated, you're probably not gonna get sick, very sick. But what is gonna happen to you is you have enough virus in your nasal passages so that when you sneeze and you spew fluids from your nose, people around you have a very good chance of getting infected. So that is all to say that the Lambda variant is all of that, and it supposedly is all of that, and it also appears to be very good at evading both the vaccine and also some of the immune gains that people have from having had COVID and from having been vaccinated for a while. That's why the Lambda variant, I would say, is very disturbing.
Well, thank you.
And Heather,
on that note, well, no, here's the thing. We're gonna do a part 2 if everybody's up later. Is everybody's up later because we gotta get to more shit.
Dystopia tonight.